Good evening and welcome to this edition of The Checkpoint. Thank you for keeping it urban. My name is Nicholas Wasaja. We are hoping that you're sanitizing, we are hoping that you're washing your hands and keeping safe from COVID-19. Today we are going to be talking about environmental protection and conservation, and this show has been recorded at the head offices of the Conservation through Public Health, CTPH head offices. It's a leafy suburb, and my guess is that you can hear a bit of gorillas here and monkeys, but I'm yet to see one. Our guest tonight is the head of the CTPH, Dr. Gladys Kalema Zikusoka. Welcome to the show.
Thank you very much, Nicholas.
Dr. Gladys is a veterinary doctor, and she has a very huge profile, but I don't think I have the capacity to introduce her and all her weight. So I'll let her talk about herself.
I would say that Dr. Gladys Kalema is a conservationist at heart, a veterinarian and a primatologist, because I specialize more in gorillas and other primates. And I've been, working in conservation for over 25 years. I actually started my journey in Chibuli Secondary School when I set up a wildlife club there. And that made me very interested in wildlife. And I felt that I wanted to be a vet doctor who also works with wildlife. And eventually it's led me up to here, where we're heading conservation through public health, which we founded in 2003.
Maybe to be a bit more specific, tell us about Gladys growing up and how you were nurtured into who you are, because you've said you are a conservationist at heart. You are a veterinarian by profession, that's what you are, but you are a conservationist at heart. So what was your childhood like growing up?
My childhood growing up was very interesting. First of all, I was the last born in a family of 6. And the sister who I follow was 5.5 years older than me. So we're just beyond each other's age bracket to play together. And I happened to have a lot of pets at home because my older brother, Katerega, who was 10 years older than me, also liked animals. Not as much as I did, but he used to bring stray cats and dogs home, which became my friends. And so I grew up in a home where I really liked animals. And that kind of led me to want to become a vet, because I hated seeing them suffering. Whenever they got sick, I would insist that my mom takes them to the vet doctor with me, and I would miss school. And yet I really enjoyed school because I never had playmates at home. And so that's what got me really interested in animals.
Dr. Gladys, you come from a quite influential family in the political circles. How did your upbringing, your parents, how did they nurture you into conservation, or is it something that it's a path that you discovered on your own and took on your own?
Actually, conservation is a path that I discovered on my own, but I would say that my parents, unfortunately, my father died when I was 2. He was one of the first people to be killed by Idi Amin when he was a minister in Obote 1, late Honorable William Wilberforce Kalema. So I don't actually remember my father because I was too young to remember him. But my mother I basically grew up just with a single parent, and lots of uncles who were father figures in my life, including the former Chief Justice Wambuzi, who was my godfather, and the brother-in-law of my mom, because Mrs. Gladys Wambuzi was my mom's sister. And they always nurtured me, all of them, to follow my dreams. And so my mom, all of us in the family, whatever we wanted to be, my mother was very willing to just follow it, even if it was different. So when she discovered that I really liked animals, she also nurtured that passion. Actually, across the road, our next door neighbor was a Cuban ambassador to Uganda, and they had a pet monkey. They acquired a pet monkey, a vervet monkey. And this vervet monkey always used to like coming to our home because I think it liked the company. And there were many cats and dogs, so it would pull their tails. It would steal food in the kitchen, like bananas. And then one time when I was playing the piano, it came and was watching me, and I moved out and it played one note, and I was so excited. And that opened up my eyes to the intelligence of primates, because not only was its fingers and just like ours, and it was so intelligent. I said, if it can even play the piano, then these animals are really very similar to us. And I think that was my first introduction to the world of primates.
But I grew up with monkeys myself, so I expected to find some when I come here, but unfortunately there is none. But the good thing is that you have dogs that I equally like. But going back to the subject of discussion, you didn't grow up with, your dad was politically killed at a tender age. Did this kind of environment in any way, did these circumstances in any way affect you growing up?
I would say that growing up without a father was difficult, I would really say, but it was probably more difficult on my mother, but she tried her best to be both a mother and a father to us. And so I'm actually very close to her because of that. But I always, when I came old enough to understand how he was killed, I realized that it was important for me to continue his dreams. He was a politician who really cared about developing the country, and he, for example, some of the things that he did, which I found out actually when one of the roads in Muyenga was named after him, because my family built the first house in Muyenga when it was just a bush. So they named that house after him, William Kalema Drive, the one going up to Hotel Diplomat. And Honorable Etiang was the guest of honor, because when my father was a minister, Honorable Etiang used to be in his entourage. He was one of the junior ministers. And so when he gave a speech, he talked about how my father went shopping. He was in the delegation that went to China when they shopped for Mandela Stadium. It was supposed to be called another name, and I think it was still supposed to be called Mandela Stadium, but it was supposed to be given for free. But because of all the political upheavals, ended up becoming a loan, because it was going to be the very first stadium that China was going to build anywhere outside China. But he shopped for that. And then he also shopped for Kibimba rice scheme, and I think Soroti meat packers as well. So he shopped for lots of things. So what Honorable Tiang said is that my father used to like shopping for Uganda, and they'd always move together in the delegations to China and other countries, which was very touching. And then later on in my career, as I went on, I got to discover a bit more about my father. For example, Honorable Ephraim Kamuntu, the former Minister of Tourism, Wildlife and Antiquities, always told me about him, because he said he was like a youth winger when my dad was a minister. He was always being mentored by my father. And so he just used to tell me many stories about him. So in that way, I understood that he really wanted to develop the country, and he mentored a lot of people who are now the ministers of today. And it made me feel like I want to follow his dream and develop the country, but through my passion of wildlife. Yeah,
so well, developing the country through your passion of wildlife, but you know, most of the policies that influence our day-to-day lives is influenced by political decisions. So beyond conservation, probably when you're saying, now I'm done with protecting the environment, would you ever consider a political career just to keep your father's legacy?
I don't think I would. I'm not really sure. I've not really thought about it, but I've seen what politics has done to my family, what it did to my dad and my mom, because my mom followed his dreams after he died and the country became stable. When President Museveni came to power, my mom decided to join politics and joined his very first party, which was the Uganda Patriotic Movement, which I think many people don't even remember. That's when she first joined politics. And when they lost the election, then he went to the bush. Then she also joined the NRM when it came into power. But in between that time of UPM and NRM, my mom suffered a lot. And even before that, you know, she went to jail like 3 times under Idi Amin, under Obote, and just because of her political beliefs. And so I guess it's put all me and my siblings off politics, because we've seen how our family suffered as a result of politics.
But you said, Gladys, you've done a very wonderful, tremendous job protecting the environment. Probably you need to protect communities too, and you know what they say, when good people leave politics to the bad people, everything else goes bad. But moving on, Gladys, you've dedicated the greater part of your life to conserving the environment and protecting wild animals. Probably you should take us through what it is like making a career out of saving wildlife.
Yep, it's an amazing career. I know that many people in Uganda don't see it as a very nice career because it hasn't been encouraged so much. But I think over time, the more role models come up in wildlife conservation, the more that people see that it's such a worthwhile career. Because we happen to be blessed with a lot of amazing wildlife. We practically have all the wildlife in Africa. You know, we have the big five, the traditional big five: elephants, rhinos, lions, leopards, buffaloes. That's the traditional big five. Although the rhino was poached to extinction, the last rhino in the 1980s in Murchison Falls National Park, the black rhino, but still Rhino Fund Uganda, with the support of the government of Uganda, has brought back rhinos. In fact, I'm a founder member of Rhino Fund Uganda in my first year when I was working in UA. But I would say that, you know, having set up the wildlife club in Chibuli Secondary, I felt that I wanted to be a vet who works with wildlife. And when I did my vet school in the UK, they used to allow me to come home and do animals of my choice, work with animals of my choice. So I worked at the Entebbe Zoo at the time when it had many orphan chimpanzees, then, which I really, really enjoyed. And I got to understand primate behavior better. And then I worked with chimpanzees in Budongo Forest under Professor Vernon Reynolds in the Budongo Forest project. It's now called Budongo Conservation Field Station. And then later on, I worked with mountain gorillas in Bwindi, in Penetrable National Park, when they had just been habituated for tourism, under the supervision of Dr. Liz McPhee, who was working with International Gorilla Conservation Program. And Professor Droma was, you know, he allowed me to go there, which was just amazing. And so, because I was stationed at a tourism site and not a research site where most researchers go, I was able to understand what tourism is doing to lift the communities out of poverty. You mentioned communities. I started thinking about them even as a vet student, because I just saw that most of the rangers were from the community, and we used to call them born-again poachers because people used to earn a living by killing animals, but now they were earning a living by protecting them. And and UA did a lot in the national parks at the time. Most of the staff they hired were from the community. So that created a good relationship already when those newer national parks were created. So after that, I felt that I wanted to just be a vet who works with wildlife. And Professor Droma gave me my first job out of vet school, and as a first vet doctor for Uganda National Parks, which later became Uganda Wildlife Authority.
But how do I find the distinction between one being a vet doctor or practitioner from a conservationist? And in this, I want to understand how your career has evolved from a veterinary officer under Uganda Wildlife Authority to now a conservationist running an NGO that is doing great work in that area.
Actually, it also came out of my experiences at Uganda Wildlife Authority. One of my very first cases within my first year of employment was handling gorillas which got very sick, and they were losing hair and developing white scaly skin. So I found out from the human medical doctors, actually Dr. Catherine Sozi, who was a family friend, she told me that the most common skin disease in people is scabies. And because at vet school I was taught that common things occur most commonly, we should think of something which is most common when we are diagnosing any disease in an animal. And so we went ahead and got the drug for scabies, which is ivermectin. We went up to the national park, also with a vet from Kenya, Dr. Richard Koch, who was coming to help us in some consultancy work to do with veterinary needs of UA. And he had seen the same disease in cheetahs in Masai Mara, except that those cheetahs who were visited by many vehicles were showing signs of scabies, and those that were not showing signs. So when we went to the park, we realized that this gorilla group had only 4 gorillas and 6 tourists were visiting it. And we thought maybe it's to do with stress, but it turned out that it actually came from the local communities bordering the park. This group likes to go outside the park, all the habituated groups actually. The moment they lose their fear of people, they go back to their former range outside the park. And the reason why I'm saying it's a former range is that people were cutting trees right up to the point when they said it's a national park. When it was under the forest reserve, there was a lot of timber cutting. And so that meant that people are not allowed in, but gorillas can still go out. And so when they go to people's gardens, people put out scarecrows, and they normally use dirty clothing, and because it's just a scarecrow, they do it to scare away baboons, gorillas, and any other wildlife. And so we think that they got it when they touched the clothing. The baby gorilla ended up dying, but the rest which we managed to treat, and they got better before we lost them. And so that kind of made me realize that you can't protect the gorillas without improving the healthcare of the people who they interact with. And that's how we eventually established conservation through public health.
Probably a bit more technical. I would understand, because there is that the primates find it easy to relate with human beings, and human beings find it easy to relate with them. But you're talking about human beings in general transferring disease to wildlife, even beyond primates. How is this possible? Because I don't see how I'm going to create a relationship with a cheetah. How is this possible?
Yes, human beings can spread disease to other species. The reason why we are more likely to spread diseases to primates is because we are more closely related to them.
Sure.
And for example, we share 98.4% genetic material with gorillas and 98.8% with chimpanzees. So they're even closer to us than gorillas, which means that whatever we get, they can get. Whatever they get, we can get. And so that's why it's much more of an issue with the great apes, because we're all great apes. Even as human beings, we're great apes like them. We're just a destructive great ape, the most destructive. But however, we can also spread diseases to other animals. And as you've known, during the COVID-19 pandemic, people have managed to spread COVID-19 to cats. So for example, zookeepers in the Bronx Zoo in New York, where there was the highest rate of COVID-19 at the beginning, they actually spread it. They were not sick, they were not showing symptoms, they were asymptomatic, but they had the virus, and they spread it to tigers in the zoo. And that was pretty surprising, but yes, because they were handling the tigers. And we've also found that in a place in Lombardy in Italy, where they had very, very many people were dying of COVID-19, when they did a study, they found that 4% of the cats and dogs had antibodies to COVID-19, of the pets of these owners. And so we can easily spread it to other animals. But the most shocking story which I've had so far regarding human and animal interaction with COVID-19 is COVID-19 spreading from people who are handling mink. Mink are like ferrets, some kind of a cat like a ferret. I don't think we really have them much in Uganda, but they're found in the colder countries. And they farm them and they use their fur to make coats. So on this farm, the handlers spread COVID-19 to the mink. And do you know what the government decided to do? They decided to slaughter over 500,000, I'm not joking, 500,000 mink, because they were worried that they're going to become a reservoir of infection for humans. So these poor animals were killed innocently, and just to protect humans again. Yet it's the humans who gave them the disease. And so it's a big deal. COVID-19 originally came from animals. Bats. We haven't yet determined what the intermediate host is. Some people think it's a pangolin, but it's not yet been proven. And in China, where people eat bats and pangolins for different reasons, could be for food or for medicine or traditional beliefs, it jumped from bats to people. And it's spread all over the world. But just as easily, it can jump back from people to animals like the great apes or any of these other animals I've just mentioned. And it can also jump back from those animals back to people. So it's a disease that whole zoonotic cycle is something that we all have to worry about, whether or not we care about animals, because it can still jump back from animals to people,
back to humans.
And we have to prevent it spreading from people to animals, just like it spread from animals to people.
But Gladys, as a researcher, probably you could help us paint a picture of whether the threat of COVID-19 in wildlife, in Uganda specifically, is real, and if it is, what's the magnitude of this threat?
The magnitude in wildlife is real, as far as the great apes go, because we are very closely related, and also we share the same protein receptors as great apes. It's called a AC, angiotensin converting enzyme receptor, ACE2 receptors, are exactly the same in human beings and primates, especially great apes and old world primates like baboons and the monkeys of Uganda. So we can easily spread COVID-19 to them. And if it got into a gorilla group, for example, gorillas don't social distance. They move in a group together. So they normally have one male and many females and many babies. And so you can't tell them to social distance. These are wild animals. And so if it gets into one, it will get into all the others. Just like scabies, it got into one and affected all of them, and other diseases that have spread from humans to gorillas. And so if we lose the gorillas, it will be a very big loss to the country, not only because it's our natural heritage, and we have an ethical obligation to protect them so our children can see them and our grandchildren and for future generations, but they also generate a significant amount of revenue for Uganda, covering up to 60% of the revenue for Uganda Wildlife Authority, as much as 60%. And this helps to run not only Bwindi, but other national parks that don't make enough money. And as much as a government, Uganda, we're the farthest ahead, I think, in the world regarding benefits from wildlife to communities. Because, for example, it's an act of parliament that 20% of the park entry fee has to be given to the local community. It doesn't matter whether or not Ua has very few tourists. And that's an act of parliament. And so with the gorillas, there's also an additional amount from every permit, which goes to the local community. $10 from every permit. So all of that means that the tourism is sustaining conservation. And so Uganda has a very good story to tell in that area. But the pandemic has disrupted all of that very much because tourists haven't been able to come.
Well, beyond the pandemic disrupting the revenue flow in the sector, you've talked about, you've highlighted statistics of how COVID-19 has affected wildlife. But then that brings me to the question of, if human beings can spread, if animals can spread COVID-19 to human beings and vice versa, what does this say of the future, the future relationship between human beings and wildlife? Does it threaten it, or they can coexist even under the circumstances?
Definitely, because we can easily make each other sick. We have to be very careful how we interact with wildlife. For example, we have to reduce habits of destroying nature. You know, every time you cut down a forest or you reclaim a swamp, you're putting yourself in closer contact with wildlife, which could potentially make you sick. And that's something that people need to understand, either by, eating it. Some people
Probably
eat.
You could say it again. For emphasis.
For emphasis, yes. Once you destroy forests or reclaim swamps, destroy the habitat of the wildlife, you put yourself in closer contact with animals in a way that they can make you sick. And that's actually where the COVID-19 issue came from, destroying nature, destroying the environment. And in the case of China, they not only destroyed the environment, but they brought these animals into very, very, very difficult conditions. The Wuhan wet life market has tiny, tiny cages. You get a wild animal, you put it in a tiny cage, it starts shedding virus because it's stressed, and it can shed to different species within that market, including humans. And that's how we ended up getting COVID-19. So it's a wake-up call that we need to stop destroying nature. We need to respect nature so that we don't make ourselves sick and wipe ourselves out. And that's something that I think it's been a very big wake-up call for COVID-19.
But moving on to the real work that you do as conserving primates, your most dear primate, the gorilla, is an endangered species. You could probably help us understand how your work helps conserve these nearly extinct species.
Yeah, our work helps to conserve the mountain gorillas. Actually, when I first started working with them, when I was a vet student, there were only about 650. And now, over the years, they are like over 1,000. And that's because of very intensive conservation efforts in the area.
I thought it was the other way around, that we are at 1,000, probably we have come from 2,000, or it's...
No, from the recent past, the numbers have actually increased. And okay, it used to be many more. It used to be thousands of mountain gorillas, you know, at the beginning of the century. Then they went down to 650 only. And now the numbers are beginning to go up again. So when I first started working with the mountain gorillas, they were critically endangered, which is the most endangered category for IUCN. And in 2018, it was dropped to endangered, which is really good. When you show that you've managed to drop a species, downgrade a species status, you know that you're really, your conservation efforts are working. And so with the mountain gorillas, you know, they've had improved veterinary care. And we do a lot of gorilla health monitoring in the national park, and where every month gorilla fecal samples are collected, where we look to see what they have and to see whether they're picking up anything from the people or their cattle or goats around the park. And that's something that is very, very important for wildlife. And then also we improve the health of the people around the park to make sure that they're not making the gorillas sick. And so especially the homes bordering the park where gorillas come out, we try and make sure they have pit latrines, they have hand washing facilities, and actually during COVID-19 they've really increased their numbers of hand washing facilities because they're worried of the disease, and our community volunteers have sensitized them more. We work with village health teams, teach them to do conservation work, and they reach every single home. We encourage them to reach every single home that they're responsible for in the parishes where gorillas come out. And this is as many as, I would say, we have quite a number. I would say maybe there's about 60 villages that they're visiting. I mean, 60 villages that they visit regularly in 6 parishes. And they try and make sure that every single person in these villages gets to hear about being healthy and hygienic. They get to hear about how to prevent themselves getting zoonotic diseases or giving zoonotic diseases to wildlife. They get to understand the importance of gorillas and why we should conserve them and why they shouldn't go into the forest to poach, because it's illegal, they're destroying the wildlife, and also they can even give diseases or pick up diseases from the wildlife. So we talk about all of these issues, and we've seen a lot of very solid behavior change amongst these communities. We also get them to adopt family planning so that they can have manageable families. And that has really helped to also reduce on the diseases within the family, because they can give them all a proper education, take them to hospital when they're sick, or get better health care for them. And this has also helped to reduce the poverty in the home and the desperate situation. So we do a lot of behavior change communication and improve health care. And then also our latest program is to support the farmers around the park. And Kani, can you bring the coffee bag? We support the farmers around the park. And what we do is we teach them to grow good coffee and process it well, and we offer them a premium price above the market price for the good coffee.
Very high. My boss Robert Kapshenga would like to hear that bit, but we are going to continue the conversation after a very short break.